Hey guys, Dr. Pelto here. What is it that you need to do if you have a really tight heel cord or something called Equinus? This is something that's not very common, but causes a lot of the foot pain that we see. And we're going to go over that today in this episode of Healthy Living. So before we begin, this is an example of a tight heel cord or someone on their toes. I want to tell a little funny story. I was talking to a patient today, and the patient said, "Hey doctor, have you ever seen such ugly feet?" And I look at, usually these are the 80-year-old females, and I look at them straight in the eye and I say, Miss, I said, you can't be beautiful everywhere. Okay. I have a lot of these one-liners that I tell my patients, and that's one of them. They can't be beautiful. And then they look at me, they said, I wish I could be beautiful somewhere. So anyway, that's one of the stories from today. Let's get into Equinus. So Equinus comes after like a equine or a horse, and it's a tight calf muscle. And you might think, why in the world do people have tight calf muscles? And what's the big deal? Well, during this time that people are less active, they're sitting on their bottoms, or maybe they're doing more activity, they can get tightness in the calf. And when this happens, they have other symptoms. The symptom most of the time is not in the calf. Usually it's in the Achilles tendon. Usually it's in the plantar fascia or in the foot, and people try to treat those things, and really the underlying problem is the plantar fascia or is the Achilles tendon, okay? And how does it impact their life? Well, people, they have pain. They have pain that just doesn't go away, or they might have heel pain that goes away and then comes back, goes away and comes back. And so I always ask my patients why they want treatment now. So let me explain a little bit about this. So there are a couple of muscles, okay? One's called the gastrocnemius and the other one's the soleus. The gastroc is on the outside, okay? The soleus is deep, and they both combine to make the Achilles tendon right here. You can see that. And if this is tight, it's going to pull more on the Achilles tendon insertion region right here on the heel. It's going to make this pull more on the plantar fascia. And so a lot of my patients, what happens, they don't have pain in the calf, but they have pain in the heel because it's the weakest part that gives way from the constant tugging, or they develop a spur or something else, or like I said, heel pain or other types of foot problems, or they change the way they walk and their heel lifts up quicker and things like that. Let me just show you here. This is the dysfunction symptom index. So basically, I use this for all my patients. The symptoms are here, so they're going to have symptoms. It might be symptoms in the back of the heel, the bottom of the heel, and they might have flat foot, pronation or flatter foot, less movement, so tightness, more movement, increasing activity causing this, bad shoes, a bad foot type, a deformity like a heel spur, something else like that. And that leads them, some people have no symptoms, a lot of people develop symptoms, but I tend to see people is they have symptoms, goes away, symptoms, goes away. And a lot of times the reason for that is because they're not treating the underlying problem of the equinus or the tight calf muscle. So the main test that we do is this test right here, okay, the silver scroll test. And basically, you want to lift up your foot. You can do this, just stick your leg out, try to lift your foot up. Now, usually when we do it as a doctor, people normally cheat with this. So you want to lift it in a way that you're not flattening your foot or going outward, okay? You should be able to get 10 degrees normally, and when you bend your knee, 20 degrees. If you can't do that, you either have gastroc equinus or gastroc soleus equinus, which is a combination equinus. Most of my patients have one of these two, and that's just, it's like in the water. It's like everyone has this, okay? So what are the treatment options? You can ignore and hope it go away. It will never go away, okay? You can do conservative treatment, which is what I do for most of my patients. And then I have some patients that are recommended surgery to do a gastroc recession. And they come and see me for a second opinion. And I say, well, let's try some of these other things first. Not saying you don't need that type of a surgery, but there are other things you can do, okay? How long does it take to get better? Well, if the symptoms are under 3 months, might take you a month. And what I'm saying is the symptoms you're seeing in the foot or somewhere else, right? If it's over 3 months, it might take you longer. The main thing here is reducing the tightness, repair the areas above and below, because usually the problems happen above it or below it, and then restore proper function. I have this. This is, I forgot to switch the name, sorry. This would be the Equinus checklist, okay? Usually I'm getting an x-ray to see if there's anything else going on there, like a heel spur. I'll start with anti-inflammatories, icing, a towel stretch, home therapy. I'll go over that with you guys. Sometimes I'll do a compression sleeve and a supportive shoe. And if that doesn't work, then I go to the more advanced treatments. But let's go into it. So anti-inflammatories, might help if you're having Achilles pain or plantar fasciitis. Reducing the tightness is the key, okay? So I usually use one of these things. This is a orb ball, a roller ball. This is a trigger point ball. This is a foam roller. This is a stick. Which one's best? The one that's best is the one you use, okay? The one that's best is the one you use. And then from there, you could try some other things to reduce the tightness. A simple towel stretch in the morning, or using something called a night splint. They tend to not work as well. There's a really good video by my friend Patrick here, and he has this Equinus brace, which goes past the knee. You have to wear it less time, tends to work a little bit better. I'll put a little link underneath this video if you want to learn more, okay? Another thing that can help is using a heel lift, temporarily a heel lift, an over-the-counter insert or a custom insert. These aren't great for Equinus. Sometimes with the heel lift, it can help. This is something I call an orthotic treatment evaluator. Some people need orthotics. You guys can go back and read this. I'm not going to read this to you, but some patients are indecisive. Do I need a non-custom or a custom orthotic? I talk a little bit about the differences here. Then there are some physical therapy treatments we can do to help them. And then some people can wear a walking boot if there's really bad pain, or a brace that goes around like a compression sleeve. So those are all the different types of treatments. I am going to, right around here, you're going to see some other videos for Equinus, that Equinus brace thing I was talking about, and then my foot treatment toolkit if you want to learn more, and also some of my books. I would love it if you comment, tell me what you think. If you're not a subscriber, please subscribe to the page, and please give me feedback so I can make better videos that you want to hear from me for. Okay, thanks guys. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.